Hello and welcome to today's CLL Society's webinar series, Living Well with CLL. I'm Dr. Brian Kaufman. I'm the Executive Vice President and the Chief Medical Officer of the CLL Society. And I'd like to welcome you to today's webinar, which is specifically on a really important issue, I think, for all CLL patients and for their caregivers. A psychological perspective dealing with the CLL emotional roller coaster. I have a couple housekeeping notes to get us started. Prior to introducing today's speaker, just a couple things that I want to mention. All attendees on the webinar are muted, but we do have an option for you to direct your questions. At the bottom of your display, at the very bottom, there's a Q&A section. Just scroll your mouse over the Q&A, and the Q&A box will pop up. Feel free to enter questions at any point during the webinar, and the speakers will have time at the end of the presentation to address any questions that you put up. After the webinar, we're going to ask you to fill out complete a short survey that you'll receive. This is very important to us. We need your feedback so we can continue to build this resource and make it better and plan for future webinars. Your comments are really critical for us to do that, so please do complete the survey. The webinar is being recorded and will be made available to everyone on the website. We'll post the presentation slides as well, so no need to ask about that. Everything will be accessible. Our last webinar on financial matters, money matters, is available on the website already. You can find both the recordings and slides under the support group / education section at cllsociety.org within about a week or so after the completion of the webinar. I wanted to thank the people who helped us underwriting the cost of this. This program wouldn't be possible without the generous support of Genentech and Pharmacyclics, who made this possible through their grant support. And now I would like to introduce today's speaker, Dr. Alison Brown. Dr. Brown is a licensed psychologist, and she coordinates the Center for Wellness and Wellbeing at Santa Monica College in California, a little closer to the water than me in Claremont, California, but we are nearly neighbors. She provides individual counseling, crisis intervention, mental health-related workshops, and training to the campus community. Alison is also a certified meditation teacher and is in the process of earning a certification through UCSD's Center for Mindfulness to teach mindfulness-based stress reduction classes. Alison was personally diagnosed with CLL in August of 2017. I'm going to pass the presentation over to Dr. Alison Brown, and I think you're in for a treat. We thank her for her time and her expertise on this important topic. Dr. Brown, please take over.
Okay, thank you so much. Well, welcome everyone. I'm very excited to be here, and I'm just going to tell you a little bit about myself before we get started with the topics in terms of the emotional roller coaster. And I'm going to tell you a little bit about my own emotional roller coaster and my health history. So when I was in my 20s, I experienced the loss of my father to lung cancer. He was in his late 50s. And then I also suffered the loss of my brother, who was only 29 at the time of his death. And he had been diagnosed with AIDS and died with some complications and sicknesses and illnesses around that diagnosis. And I lost them both in a very short amount of time. I also have other family members that have had cancer. My mom was diagnosed with early stage breast cancer when she was in her 20s. My grandmother had colon cancer when she was in her 70s. Sorry about that. And then, so my grandmother also in her elder years had colon cancer. So there was a lot of cancer and illness in my family. So I was faced with that at a pretty young age. So I became pretty hypervigilant about my own health. And I had some weird thing happen in my late 20s too, where I had 2 retinal detachments. I'm very nearsighted. So So I had to have surgery around that. So I have to say it was pretty traumatic, and I definitely struggled with fear and anxiety and a lot of hypervigilance around my own health. So I became like very healthy. I would eat well. I would exercise. You know, I was reading all the latest trendy books about diet, nutrition. I was a vegan for a while, vegetarian, all of that stuff. So when I eventually did get diagnosed with CLL, and actually it was in August 2016, and it had come at a time when I was under a lot of stress at work. We were short-staffed in our office, so I was basically kind of doing two jobs instead of my own job. And I got sick with just a really bad cold that wouldn't go away. And all of a sudden, I just developed this large lymph node in my neck. And I was like, that's strange, because I wasn't somebody who had lymph nodes, like swollen lymph nodes. I'd never had that before. And I was also getting out of breath very easily. And so I was going to various doctors to try to see what was going on. And nobody was able to really diagnose me until finally an ENT doctor that I went to ordered some blood work. And she said, hey, do you know that you're severely anemic? And I said, well, no, I didn't know that. And based on that, I was referred to a hematologist, and long story short, I had multiple tests, and I was diagnosed with CLL. So at that time, because here I'd been someone who'd been so hypervigilant about my health, and I was trying to stave off any illness, like with my good behaviors and healthy habits, and then I ended up getting diagnosed with something I'd never heard of before. I was like, I don't even know what CLL is. There's no leukemia in my family. How in the world could I possibly get this illness that just seemed to come out of left field? So it really threw me for a loop. I ended up getting a second opinion about treatment. I left the original hematologist that I'd gone to. He wanted me to get kind of some harsh chemo treatment, and I didn't want that. So I went to City of Hope, got a second opinion. My doctor there said that she just wanted to treat the autoimmune hemolytic anemia. She said that the CLL did not need to be treated. At that time, it wasn't burdensome enough. So I had Rituxan, a few treatments of Rituxan, and I seemed to get better. I still had the lymph nodes, but then the anemia returned during that spring of 2017, and I had to get a blood transfusion, and certain things were, you know, my health was not doing well, so I ended up entering a clinical trial in July 2017, was treated with Gazyva and chlorambucil, and finished my treatment in December 2017, and have been on watch and wait ever since. And I do get monitored at City of Hope because I was in a clinical trial. Part of being in the clinical trial is to get CT scans and blood work and meet with my doctor every 3 months. So I've been doing that since that time. So I want to move on to just see kind of what's going on with our audience here in terms of where they are in the treatment, in your own treatment. So if you can go ahead and answer this question: what is your treatment status? Never been in treatment, only watch and wait, currently in active treatment, less than 1 year post-treatment, or more than 1 year post-treatment. Okay, great. Okay, so we have 71% of you have never been in treatment, you're only in watch and wait, and then a smaller number currently in active treatment, an even smaller number, only one person of more than 1 year post-treatment. Okay. And I could probably answer two of those because I'm actually in watch and wait, but more than 1 year post-treatment. So this is actually a great slide for most of you who are in watch and wait. I could not wrap my head around watch and wait. I didn't really understand what that means. I mean, the idea that we have quote unquote the good cancer, and I was actually told that by the first hematologist I went to because I started crying when he said I would need chemo. And he said, oh, don't cry. You have the good cancer. So I had to wrap my mind around that. What in the world? How could good and cancer be in the same phrase? It seems like an oxymoron to me, sort of like jumbo shrimp. So I didn't understand this at all, because it really is like, it makes no sense, right? To be diagnosed with cancer And the whole purpose of a diagnosis is to, inform treatment planning, and then the treatment of choice is to do nothing but monitor. So when I think of that watch and wait, it's like, well, wait, what am I waiting for? I'm obviously waiting for something terrible to happen. I'm waiting for the shoe to drop, what's around the corner. Obviously bad news and sickness and illness and death, right? So there's a lot of uncertainty and a lot of lack of control, right? So if I'm not getting treatment for my illness, what can I do to make myself better, right? The doctors are basically saying, do nothing, just do what you're doing. And that's just so off-putting, and obviously can lead to a lot of worrying and anxiety. And I just want to say something about the negativity bias. So that's a term that often psychologists use to talk about our tendency in our mind to be more biased toward negativity. So it's basically, when we talk about the negativity bias of our minds as humans, we're talking about how our body generally reacts more intensely to negative stimuli than to equally strong positive ones. And from an evolutionary perspective, this was basically a survival technique, right? We stayed alive because we were vigilant to dangers in our environment. If we can avoid danger, we can survive, we can stay safe. So basically, as a psychologist in Northern California, Rick Hansen, says, his quote is that our brain is like Velcro for negative experiences, but Teflon for positive ones. So let's say we're walking down the street, out of the corner of our eye, we see a stick on the ground. We may see that as a snake if, let's say, we're hiking or something, because that's more dangerous to us than a stick. We stay alive by seeing the stick as a snake. I hope that makes sense. So anyway, there is this tendency in our mind to lean more toward negativity, safety, etc. And this is actually a very helpful thing when it comes to our survival. But if we're not in an immediate danger or facing an immediate threat, then all it does is kind of increase our stress levels. So I want to first talk about this whole idea of the watch and wait and dealing with uncertainty. So when we're dealing with uncertainty, there is feelings of helplessness and powerlessness that may feel overwhelming, right? So when we're faced with this feeling of helplessness, we often try to establish control, right? So for example, when I was in my 20s and moving forward in my life, the way that I thought I was establishing control was by being really healthy, eating a good diet, exercising, all of that. I thought, if I can do that, I won't get sick. We also can do this by worrying a lot. So oftentimes we'll worry and worry and worry about things, and worrying can be both helpful and harmful. So the helpful side of worrying is that we have this amazing capability to plan for the future, right? Our brains are very high functioning. Unlike animals, we can kind of predict or try to predict the future and plan for difficulties, right? So we may worry about things that can happen in the future, and if there are things that we can do about it and plan for it, then it's very helpful, right? So for example, if I'm trying to get to the airport on time, I'm going to look at the traffic and plan. If I see there's a lot of traffic, I'm going to give myself extra time, right? So it's a good thing to kind of think about the future. But it can be harmful if we're worrying about things that we can't do anything about. And one of those things could be this watch and wait period, right? So we may not be able to stop the CLL from progressing. We may not be able to stop ourselves from getting sick in the future. But yet we worry about it anyway, even though there's nothing that we can do. And I wanted to add these quotes here that I just think, I love these two quotes about worry. One is from the Dalai Lama. He says, if you have fear of some pain or suffering, you should examine whether there's anything you can do about it. If you can, there's no need to worry about it. If you cannot do anything, then there's also no need to worry. Another quote, which you may be more familiar with, is the famous serenity prayer. Often it's used in AA. Grant me the serenity to accept the things I cannot change, courage to change the things I can, and the wisdom to know the difference. Another way that we try to deal with uncertainty is we try to fill in the blanks when we don't have all the answers. So we end up having what in psychology is known as unhelpful thinking styles or cognitive distortions. David Burns is a psychiatrist, and he came up with these, and he's a cognitive psychologist. He came up with these cognitive distortions, and he's a great writer. I don't know if anyone's familiar with this book, Feeling Good, The New Mood Therapy. It's a great book to read. He talks a lot about these cognitive distortions and how to modify them. So I'm just going to quickly go through these. I think we can all relate to them. It's just something most of us do, and we do especially when we're feeling stressed. So the first one is that all or nothing thinking. So we look at things in absolute black and white categories. So we can think about that with our health, like I'm sick or I'm healthy, right? So it's like black and white. We can also overgeneralize. So we view a negative event as a never-ending pattern of deceit. So we take maybe something that happened that was challenging or negative, and we see that as coloring our entire world. We also often can use a mental filter, which means we dwell on the negatives and ignore the positives. So again, it's kind of like the good cancer of CLL. I focus on the word cancer. I don't focus on the word like good, which I could look at and see as well. I'm still able to work. I'm doing very well. I can do many things that I could do before this diagnosis. I'm continuing to be able to do some of these things. So I just focus on the negativity of the word cancer. Other things we do often in our mind is we jump to conclusions. So we conclude things are bad without any definite evidence. And we can do this through things like mind reading, when we assume that people are reacting negatively to you. So we think we can read another person's mind, and we decide we understand their motivations, when in truth we probably don't. We can also engage in fortune telling, where we predict that things will turn out badly, and we definitely can do that when we think about our health or our diagnosis with CLL. Another one that I do this one a lot, which is the magnification, which is catastrophizing, which is kind of like we worry about something that might be happening right now, and we project into the future and think of all these horrendous things that will happen that haven't happened yet. And our mind and our body are reacting as if they're happening right now, even though none of it has happened, but we're magnifying the negative event. We can also do it where we minimize, and I do that a lot too. So I do both, where the minimizing is we shrink the importance of things. So it could be, for me, sometimes, I overblow the CLL diagnosis. I minimize, again, all the positive things that I have going on in my life and that I can still do. For example, I think of it with exercise. I used to love to go to Zumba classes. I used to go to the gym all the time. I have fatigue now. I can't really do that, but I can do other things like yoga or Qigong. I can walk, but I see those as not as important because I wish I could still be doing the things that I used to be able to do. The emotional reasoning, the next one, is we reason from how we feel. So, for example, if I said to myself, I feel like an idiot, so I must be an idiot, right? Because we feel a certain way, then it must be the truth. Should statements or must statements, we all make those, like I should eat better, I should do this, I shouldn't do that, I must do this, I must do that. Those tend to be around like criticizing ourselves or others for things they should or shouldn't be doing. Oftentimes they just lead to feelings of guilt or shame or anger, and who is creating these rules anyway? Labeling is another one where we just we label ourselves like I'm a jerk, or I'm a bad person, or he's a bad person, she's a bad person, and we blame Blame is a big one, where we blame ourselves for something that we weren't entirely responsible for, or you blame other people and overlook ways that you contributed to a problem. So these are all ways that our mind works at times of stress especially, but even when we're not, in times of stress, our mind can just go to these places. So I find this list so helpful because, first of all, I don't personalize the way my mind works because this is so common. And I can also recognize these thoughts as being unhelpful. And I'm going to talk a little bit more about how these thoughts can be unhelpful to us. So I'm going to talk about the relationship between thoughts, moods, and behaviors. So let's say we have a thought. And let me think of a thought. So a thought could be, I'm so tired and nobody understands me. So this might lead to an emotion or a feeling such as maybe loneliness, feeling misunderstood, sadness, anger. So emotions can come up in response to this thought. And then the behaviors could be things like, I'm going to isolate myself with others, so I'm going to not talk to anybody. I'm going to, and I'm talking about this from experience because that tends to be my habitual style of, like, when I'm feeling down, I tend to isolate myself, and instead of reaching out to others, I just stay home and don't talk to anybody. But then that can also lead to other thoughts such as, I have no friends, I'm all alone, I'll always be alone. So this pattern can occur where we have this circular relationship between thoughts, moods, and behaviors. And oftentimes we can't necessarily change the thought per se because the thoughts often are pretty automatic. If you start paying attention to your thoughts, I guarantee you're going to find you have like a top 10 of thoughts that come up when you're experiencing any strong emotion. So we have those top 10 thoughts. They're usually like put in place from childhood practically. They come up over and over and over again, and we react to them and have these feelings and behaviors. So the thoughts can be sometimes hard to change, but we can look at them differently, and we can also change our behaviors. It's hard, I would say, to change the thoughts and emotions, but behaviors we can change. So if I give you that example of when I think I'm being misunderstood and nobody understands that I have this cancer because they say I look good and I look healthy and they just don't get it and no one understands me, and I isolate myself, I feel more lonely. It actually intensifies my emotions of sadness, loneliness, and depression, right? Rather than nurturing myself around it. So if I change my behaviors and actually reach out to someone that I trust and do something fun with people, then it actually minimizes the impact of the thoughts and minimizes the emotions. I pulled this from Mindful magazine. I just really like it. It's an excerpt from Alicia Goldstein's book called Uncovering Happiness. And it's a way to kind of respond to your own thoughts and put some space between you and your reaction. So then what that does is it changes your relationship to your thoughts. So you can kind of watch them come and go, and you don't treat them as facts. Because again, with that emotional reasoning, we tend to treat our thoughts and our feelings as if they're factual, rather than kind of a passing state of whatever we're experiencing in that moment. So one way to challenge a thought could be to first ask yourself, is it true? And oftentimes we do say yes, right? Because that's our brain initially reacting. It's like, yeah, of course it's true. I wouldn't have thought it if it wasn't true. But then the next question you can ask yourself, well, is it absolutely true? Is it 100% accurate? Can I see this thought in a different way? And usually the case is yes, you can. It could be 90% true, but what about that 10% where it's not true, right? So looking at it, is it is it so black and white? And usually it's not. So the third question could be, how does this thought make me feel? So again, looking at that relationship between the thoughts and the feelings and emotions. And also notice any storylines you're holding on to and name your feelings. Because there is this expression in psychology, I don't know if you've all heard it, but often if we name it, we tame it, because we actually move our focus of the brain from our amygdala, which is kind of like alarm central. It's sort of like our smoke alarm. So when it goes off, we go into fight or flight mode. And when we name the emotion we're feeling, we actually then turn on our prefrontal lobes, which is where we have our higher executive functioning, right? That beautiful part of our brain that can plan and can think and be more abstract. So again, we name it. Okay, this is making me feel sad, right? So what would things be like if I didn't hold this belief? So if I didn't hold the belief that everyone misunderstands me and no one gets what I'm going through, like I would feel more supported if I wasn't holding on to that belief. I would feel more able to reach out and believe that others are there for me and that others love me. So that's a way, again, to not get rid of the thoughts per se, but look at them differently. Change your relationship to the thought. Okay, so we're going to go to the next polling question. So have you shared your diagnosis with others outside of your immediate family or social circles? Yes, on social media. Yes, with acquaintances and or coworkers. Nobody outside of my immediate family and medical team. Nobody other than family and closest friends and medical team. Or I have not shared my diagnosis with my immediate family or social circle. Okay, so it looks like most of you have shared your diagnosis with acquaintances and our coworkers. A few of you have not shared, just one has not shared it with anyone. And then the next, nobody other than family and closest friends. So 28% of you. Okay, great, thank you. Okay, so I can answer that question myself. Is I have shared it with some friends and family and a few coworkers. I try not to, but my most immediate coworkers, the kind of need to know people. Okay, and the reason I asked that too was because again, I thought of that thought of like thinking maybe people don't understand me, especially given that I might look good on the outside, and can this cause a feeling of like isolating yourself, and that can add to the stress. But also, you know, knowing that you have that support system and the people that you have shared your diagnosis with. I want to now move on to the idea of stress, because oftentimes this diagnosis can cause a great deal of stress in our lives, in our day-to-day experience. So I want to just go ahead and define stress. I found this first definition of stress, and I should have credited it from a course on the great courses, and I should probably add that I didn't cite the person, which shoot, I should have. So I can't remember the woman's name, but I can always add that later. But she said that stress is what arises when something we care about is at stake. And I love that definition so much because it reminds us that the reason we're stressed is because we care about what we might lose, right? So we wouldn't feel stressed if we didn't care about it. So it gives us a different framework to look at stress. The other definition of stress, which most of us probably know this one, is the body's response to a challenging event, right? So we react to stressors. So stress is what happens like in our body, so to speak, and the stressors are the trigger. So there could be external stressors like a threat or perceived threat to our physical safety. So clearly like our illness can be perceived as an external stressor, but we also have internal stressors, which is stress. The threat is in our internal world. And usually those are our thoughts and emotions. So worrying about the illness. And looking at the idea of the difference between the external stressors and the internal stressors, we can see that stress is often influenced by our perception of the stressor. So I give the example of I have a very long commute to my office. Brian was saying he lives in Claremont and I'm all the way by the beach. I work by the beach. I do not live near the beach. So it actually takes me an hour to get to work every day if I'm lucky, or over an hour if I'm not lucky. So when I first started working at Santa Monica College, traffic was very stressful for me. And I just assumed everyone hates traffic, but I've actually talked to people, friends of mine who are moms, and they kind of love being in traffic because to them, it's the only time that they're not being bothered by their kids or their family. So they get their alone time in the car. And I was like, oh, that's so interesting. So again, when we're stressed about something, we really want to look at like what's triggering the stress and does it have anything to do with the way I'm perceiving the stressor? And a good question to ask yourself too is, how do I know that I'm stressed? Again, it's our body's response. So how do I know that I am stressed? So we can start looking at various ways our body is telling us that we're stressed. Here are some of the more common symptoms and signals of stress. And again, this list is not exhaustive, but these are sort of the more common ones. So we have physical symptoms of stress. For me, fatigue, indigestion, and headaches are ones that I tend to have when I'm very stressed out. I also get muscle tension in my neck and shoulders. So that's sort of my signal, hey, something's going on. I'm feeling a lot of stress right now. There can also be cognitive symptoms of stress. So a loss of perspective, obsessive thinking or rumination. So a lot of that worrying, going over something over and over and over again. Scattered attention, so it may be difficult to concentrate. Your memory might be off a bit. I think of that I work with college students, and when I talk about test anxiety, we'll talk about how oftentimes a student has studied, they know the material, they sit down to take the exam, mind completely goes blank, right? Because they're in a very high level of stress. There's also emotional symptoms of stress. There can be impatience, irritability, anxiety, even depression or anger. And I'm sure we've all had those moments where people around us are like, hey, you're really stressed. And you don't even know you're stressed, but everyone around you knows that you're stressed, and it's usually because of these emotional symptoms. So it's important for us to get to know our bodies and know kind of what are the things that are stress, how does our body react to stress? What are the things that are stressing us out, so that we can take care of ourselves. And also so that we can start to recognize that we are experiencing stress before the alarm bells go off, before the other people around us are like, hey, you got to go chill out or whatever, so we need to kind of get to know ourselves so we can nurture ourselves and take care of ourselves before we're moving into higher and higher levels of stress. So which interferes most with your daily functioning? Emotional symptoms, physical symptoms, both emotional and physical symptoms, or neither? Okay, so it looks like the majority are experiencing both emotional and physical symptoms. Okay. And the next is emotional, and then we have physical, and then we have neither. Okay, great, thank you. So I want to talk about when we do experience things like anxiety, stress, depression, regret, kind of the strong feelings that we might be experiencing around our illness or any stressors. Usually we're thinking about the past or the future. And it pulls us away from the here and now. So if you look at why would it be that thinking about the past or future can create or increase feelings of anxiety or depression? Well, if we think about anxiety tends to be very future focused. So I think of anxiety as like worrying about what's going to happen in the future. And it could be based on our past experiences, right? But we're thinking about the what ifs. So if we're spending a lot of time worrying about the future, it can increase our levels of anxiety, fear, stress, etc. It can also lead to sadness, but again, it's more of that anxiety that is future focused. When we're spending a lot of time thinking about the past, that tends to lead to more feelings of sadness, regret, depression, could be anger, things like that. So we see how it can increase some of these quote unquote like negative or unpleasant emotions. What can help us cultivate present moment awareness, because if you start paying attention during the day to where your mind is focused, you're going to notice you're not in the present moment very often. So practicing mindfulness can help us cultivate this present moment awareness, which we're often, we have definitely active minds. We can get very lost in thoughts and we're not truly here and using all of our senses. So what is mindfulness? It's very popular right now, so my guess is you've heard of it, but if not, I just wanted to present some definitions. So basically, mindfulness is the practice of becoming more fully aware of the present moment. And again, like I said, using all of our senses, so sight, hearing, taste, smell, all of that, touch. So it's rather than dwelling in the past or projecting into the future. And I wanted to add also, because I really like John Kabat-Zinn's definition of mindfulness, because, easier said than done, but how do we, cultivate this skill of mindfulness? It's cultivated by paying attention in a sustained and particular way. So on purpose, so there's intention around it. So we are intending to be mindful. We're paying attention to what's happening in the present moment, not paying attention to what our thoughts are telling us, right? Or what the pain in our body is telling us in terms of the stories that we're telling ourselves around this pain, but what is actually happening in the present moment. And also to cultivate it without judgment. That's probably the hardest one, because as human beings, we're basically judgmental. We have thoughts and opinions about everything. But those opinions and thoughts can really narrow our perspective. So can we open up our perspective and perceive what's happening in the moment with more spaciousness, a wider perspective, and more kindness around it? There are formal ways and informal ways to practice. So one of the best formal ways to practice is meditation. And there's plenty of different apps and things like that to practice meditation. Basically, all meditation is being still and having an object of focus that you bring your attention to over and over again. So we often hear about mindfulness of the breath, right? So we would sit and meditate by bringing our focus back to the sensations of the breath in our body. We do that over and over again. Every time we see that we're lost in thought or our mind has wandered, we gently bring the attention back to the breath. There's also informal ways to practice, and that's bringing awareness to everyday activities. Usually that's picking an activity that we often do mindlessly, like washing the dishes or taking a shower, and instead we bring that mindful awareness. So if you're washing the dishes, you're going to really pay attention to what you're doing rather than getting lost in thought. So you feel the water on your hands, you smell the fragrance of the dishwashing liquid, all of it. You feel your hand moving as it cleans the dishes, things like that. So you're training your mind. It's really mind training. So I think of mindfulness practice as calisthenics for the mind. Just as you would go to the gym to work out, to strengthen your body, you practice meditation to strengthen your mind and your ability to choose where you're going to focus your attention. So you're increasing that mindfulness muscle. Okay, so this fancy framework here, I just like it. I learned it when I was getting my initial teacher training at the UCSD Center for Mindfulness. We can look at this triangle in two different ways. Everything in red is kind of our stress reactivity cycle. Everything in blue is our response cycle. So we're working on our mindfulness practice to try to move more to a sense of responding to the stressors in our life, right? Rather than just knee-jerk reactions. And the knee-jerk reactions are those habitual reactions to stress. And those could be habitual ways of thinking, feelings that come up, thought patterns, behavioral actions, all of the things we automatically do in response to stress. So the S on the top of the triangle is the stressor. So what's causing the stress? So let's say, you know, the stressor could be our diagnosis of CLL. So we hear that, and then we hit the gas pedal, basically, right? Our body reacts right away. It's automatic. Our sympathetic nervous system gets kicked into gear, and we have the A, which is we get activated. So that could be our heart rate starts increasing. We start thinking about the future, right? Like our we get sweaty. Our heart is beating. All those things that happen in our body. Our mind is going a mile a minute. So then we go to the R, which is our reactivity, and usually that's going into like a doing mode. Oftentimes when we go into fight, flight, or freeze, which is that very high level of panic and stress, which is a survival mode. So it's good if we really do have an immediate danger. So when we go into fight or flight, when we step off the curb and a car is coming toward us and we jump back without thinking about it, we want that fight or flight response. It saved our life, right? In that moment, we didn't have to think about jumping back. Our body knew what to do. But when we hear about our diagnosis of CLL, there's nothing that we can really do in that moment, right? Other than take care of ourselves in some way, but we don't do that. We think the threat is immediate and we go into doing mode, whatever that is, right? So we want to do something. We want to fight this disease, or we want to flee from it and numb ourselves out, or we want to freeze, like we get just frozen in place and paralyzed with fear. Whatever it is, we want to do something. And then we go into what we call our habitual reactions to stress, and whatever that is for you, right? So it may be, I don't know, I'll look at my own, like binging on TV or something. I just want to go and numb myself out, and I want to isolate myself from others. All these like definite habitual reactions. My thoughts might be like, of course I ended up getting sick. Everyone in my family was sick. Of course I got this stupid disease. And then that just increases our stress, right? So you see how the cycle goes round and round and round. And all those things that we see in red are just, we're on autopilot, right? So these are just things that are going to automatically happen just through years and years and years of conditioning. And then it's just the biological response of the fight or flight in our sympathetic nervous system, which again is a great thing in short doses when we need it, not a great thing when we're not in any immediate danger. So we want to move into the response cycle by hitting the brakes, right? So you see on the left side, the brakes. How do we do that? We can bring awareness to what's happening in the moment, and that's through mindfulness practice. And we can sit with whatever we're feeling. I know that sounds hard, but when there isn't an immediate danger, it's best to just sit and notice what's happening so that we can then respond to the stressor and have a new relationship to our stress. This takes a lot of practice, which is why with mindfulness, there's both formal and informal ways of practicing. It just doesn't happen overnight. So it's a slow process, just as like going to the gym. You can't just go once and then never go again, right? You have to keep on moving your body and exercising in order to see the benefits. It's the same thing with a mindfulness practice. And as we move more and more toward awareness of our own activated response, or rather reaction to stress, then we can develop this mindfulness and respond more thoughtfully. I do want to read this wonderful quote by Viktor Frankl. He's a Holocaust survivor. He wrote an amazing book called Man's Search for Meaning, and he wrote in his book, "Between stimulus and response, there is a space. In that space lies our freedom and power to choose our response. In those choices lie our growth and our happiness." So that space is what we're trying to create with mindfulness, right? So that it's not just the knee-jerk response. Okay, just quickly, I want to just say a little bit about the difference between depression versus sadness, because we all feel sad or blue, especially in reaction to life struggles, setbacks, loss, or disappointments. This is usually temporary, and it doesn't significantly impact our daily functioning. Depression, on the other hand, is more of an intense feeling of despair or emptiness. It doesn't seem to go away. It makes it difficult to complete daily tasks, and no matter kind of what you're doing to help yourself, it's not lifting this heaviness of depression. So I wanted to also just look at some of the common signs of depression. And a lot of these, again, don't mean that you are clinically depressed, right? But again, if they've become overwhelming, they don't seem to go away or get better, it may be time to seek help and seek more support, right? Maybe get some psychological assistance to help you move through this depression, this episode of depression if it's not lifting. Okay, polling question number 4. Okay, what is your predominant emotional symptom related to having a CLL diagnosis? Fear and or anxiety, depression and or loneliness, anger, grief. I frequently feel most or all of these emotional symptoms, or maybe one that's not listed here, then you would click on other. Okay, yeah, so this is actually what I did imagine, fear and or anxiety. Okay, and then the second highest is most or all of these emotional symptoms, but the majority is with the fear and or anxiety, and that seems to go along with that most of you are also in that watch and wait period. Okay, that makes sense. Okay, so in ways that we can take care of ourselves while we're going through this, especially if you are experiencing a lot of emotional or physical symptoms, but a lot of emotional symptoms, is to make time for self-care and to really look at self-care as taking care of all aspects of yourself, not just your physical self-care. When we have an illness, we can get caught up in just taking care of ourselves around our illness, you know, the physical symptoms of the illness. But I think it's so important to really take care of all aspects of self and to build that time in. Make it a priority. You are the priority. Your entire being is the priority, right? So that means engaging in physical self-care, the psychological self-care, the emotional self-care, the spiritual self-care, and professional self-care if you are still working, if you're not working, volunteering, getting out there, really connecting into your community, and again, taking care of yourself at all levels. Additional coping strategies. This first one is one that I've had to work on very much because I don't tend to be very compassionate toward myself. I have a lot of compassion toward others, but not toward myself. And Kristen Neff, you can go to her website, which is here, self-compassion.org. She talks about all the different aspects of self-compassion. She has 3 components there that encompass the idea of self-compassion, the self-kindness versus self-judgment. So again, giving yourself some kindness just as you would to other people who are suffering. Looking at the common humanity, just our experience. We're not the only one out there experiencing what we're experiencing. Suffering is part of life, right? It's just part of the human experience, right? But we can often see it as only happening to us, right? This feeling of being alone and isolated. So looking at the broader picture, right? That this is part of life. And also the idea of bringing that mindfulness into the picture versus the over-identification. So allowing yourself to be with the painful feelings as they are and avoiding extremes of either suppressing or running away from your painful feelings. So again, having that sense of wanting to take care of yourself and alleviate your own suffering around your illness or whatever else is going on. Practicing gratitude is another really wonderful thing to do. You can go to this website, Greater Good at Berkeley. They have great ideas of how to practice gratitude because it really is a practice. We want to practice this to kind of counteract our brain's negativity bias. And there's so many proven research-based benefits that have been found to support the idea of practicing gratitude. There's an increase in our psychological well-being. It's a great component in coping with any trauma. It also can increase post-traumatic growth as opposed to post-traumatic stress. It lowers our risk for developing depression and anxiety, etc. So also increasing your social support, really plugging into your community, whatever that is. You know, people that you love and trust, people who love you, like increasing that, moving away from, again, alone time is great, but not if it's too much and it's causing you more depression or anxiety. And as I said before, seeking out psychological and or psychiatric support if the symptoms are significantly and negatively affecting your thinking, emotional state, and behavior over time. Because again, it's fine if it's there for a short period and it moves away, but if it's not going away and it's disrupting your ability to carry out your daily activities or engage in satisfying relationships, then it may be time. And I've sought my own, and it's been really helpful for me. And I just wanted to, our last slide is just give you some resources that I found very helpful in my own journey. And they're right here, the books, the meditation apps such as Calm and Insight Timer, if you want to find some great guided meditation to practice. And these are great because if you only feel like you can meditate for 5 minutes, then they've got meditations that are short, long, all different kinds. They're wonderful. And because there's so much to cover in this workshop, and I know that there isn't a lot of time for questions, please feel free to email me with any questions you have. And my email is right there, brown_Alison@smc.edu. I'd love to hear from you and just see how you're doing. And if I can help in any way with answering any of your questions about topics that were brought up today, I'd be happy to do it. Thank you.
Alison, this was incredibly helpful, amazingly informative. We do have a number of questions. I found it very helpful, and I so appreciate it. I'm gonna, in the interest of time, I'm gonna start with a question that we have here, and this is, what is a good strategy for dealing with the tendency to react emotionally to new physical symptoms? I'm wondering whether they're from the CLL or not. We all have a tendency to stub our toe and say, well, that's because of the CLL. How do you handle that?
That's a great question. Because my own diagnosis of CLL came after when I just had a cold, bad cold, and then my lymph node increased, and then I had rapid heartbeat around the anemia. I'm tired. So anytime I have fatigue, anytime I get a cold, anything that happens to me, I go into a little panic mode. It's like, oh my God, my CLL has returned. I'm going to have to go back into treatment. So my mind, that's my own habitual reaction, right? Is that I panic around it. So kind of the things I was talking about earlier in terms of, understanding that we're going into reaction mode, and to bring again that sense of space and awareness to pause for a second and think, like, is this necessarily true that this is my CLL? What can I do to take care of myself? Am I worrying about something I can't control, right? So understanding that unhelpful thinking styles of like catastrophizing, magnifying each little symptom into possibly CLL, being tired, having a swollen lymph node, having a rapid heartbeat can mean many, many, many different things. It doesn't necessarily mean that it is the CLL. So again, just trying to put that thought into perspective, and also the understanding that reaction, the strong emotional reaction and the fear and anxiety are around the thought, which is, oh my God, it's the CLL. Because it could be many other things, and just taking care of yourself around that should be helpful.
Here's another common question I think a lot of us have dealt with, and it's, my friends all tell me how good I look, but I feel awful. What do I say? I mean, they're well-meaning. It's as if they're doubtful that I have cancer. They don't, it's like, you really have cancer?
Yeah. So, yes. I have that too all the time. when I first got diagnosed, there was a lot of worry and concern around people in my immediate circle, and they were very supportive. But as time has gone on, and I'm more on the watch and wait, I think that people just think I'm fine, I'm better, but I still struggle with symptoms. Like I still struggle with fatigue and things like that. So, we have to look at, again, like, what are we adding to the situation? Is it true that they don't understand, right? Like, does that statement truly mean that they don't believe that I'm sick? Or am I just projecting something onto the situation, right? So, again, kind of the same advice I was giving to the last question, which was, to really try to widen your perspective around it, to see what you're adding to, and being okay with your own reactions to, because there may be doubt in your own mind about, like, do I have a right to complain? Do I have a right to take a day off? Do I have a right to give in to my fatigue? I don't have the quote unquote bad cancer. I have the good cancer. So looking at all the things you're adding to your own suffering, not just what the other person is saying to you. I hope that that's helpful.
Good. I think we have time for one more question, and it's a tough one. Any advice on handling the fatigue, which seems to be ubiquitous in CLL? Any advice? Somebody asked about that.
Yeah, I wish I had a great answer for this one, because it's one that I struggle with myself. And what I've been trying to work on in my own life is trying to have more love and compassion for my own body, and my body's own limitations in the moment. And again, not projecting into the future, trying to add anything. So if I'm tired, I'm tired, and I need to take a break, or maybe I need to take a nap. Or if I'm at work and I can't push through the anxiety, then I have a cup of coffee. I used to be this perfect diet kind of person. And I'm not advocating coffee, but for me, the coffee helps in the afternoon, or getting out of my office, taking a walk, or just resting, doing a short meditation, taking a quick nap. So not fighting so much with my fatigue. I have, for years, I still have it. I have a lot of resistance toward my own fatigue. And there's a great, and again, I can't remember who said it, but there's a great little quote around resistance, and it's pain times resistance equals suffering, right? So the resistance is all the things that we're adding to it, or we're denying that it's there, or we don't like that it's there. We don't want it, we're like pushing against it. And that just ends up increasing our suffering rather than decreasing our pain. So Brian, you may have better answers to the fatigue question than I do, because again, it's something that I'm just trying to have kindness toward myself around.
So we've published an article on the website around fatigue, and we talk about this, and it's such a common problem. And there are, I think, things that are helpful. I think one of the things ironically, is to stay more physically active. Generally, the more you exercise, the more energy people have in terms of the fatigue. You also want to make sure that there's no other medical conditions or things related to the CLL that are an issue there. And in the occasional case, there are some medications that can help with this. But we have a nice article on dealing with this. And that lets me segue into a question that I'll take here. And then I think we'll just close things up about medications for anxiety and depression, and whether they create complications with CLL. And if they are indicated, if you're clinically depressed, and I think Dr. Brown laid out some guidelines in terms of that depression, or if the anxiety is so disabling that you can't really function, you have severe insomnia, you're not able to work or be with your family, there are medications that can help with this. And generally, the only concern is some of them are metabolized the same way as some of the CLL medications are metabolized. So that may need that you have to adjust the dose of one of those medications. But in most cases, there is really no clinical concerns about taking antidepressant or anti-anxiety medications with CLL. There may be some drug interactions that may be the only issues that's a concern. So again, I want to thank Dr. Brown so much for this. This was so helpful. And I want to remind everybody that they'll be getting a survey by email. And please, please, please complete that. That's what allows us to continue to do this. And if you have further questions, this will be up and live within a week. You can send an email off to the email address there. And I thank everyone for participating. This was so helpful to me personally, and I hope to everyone else. Alison, thanks so much.
Oh, you're very welcome. Thank you.
All right. And with that, I think we'll say goodbye.